Here is our model of the heart. What we're looking at is an anterior view currently. A few things to keep in mind when we're looking at the heart and the surrounding blood vessels. Red does not always mean artery, and blue does not always mean vein. Instead, the red coloration is signifying oxygen-rich blood. The blue coloration is signifying oxygen-poor blood. What we know is true is the arteries will always carry blood away from the heart, while the veins will always carry blood towards the heart. So let's start by trying to figure out how the blood comes back into the heart from the systemic circulation, or the circulation of the body. We can see in this view the superior vena cava. The superior vena cava will bring blood back into the right side of the heart from the arms, upper chest, and head. It comes in behind this structure, which is the right auricle. It's the flap that covers and goes over the right atrium. You can see the left auricle over here on the matching side. So if we go to another view, you can see a little bit clearer what we have going on here. We have the superior vena cava right here. We'll bring blood down into the right atrium. We have the inferior vena cava down here, bringing blood from the legs and torso up into the right atrium. Well, this right atrium will contain the oxygen-poor blood. It'll have some musculature in the walls of the atrium. You can see these ridges or lines here. Those are symbolizing the pectinate muscles, the musculature of the walls of the atria. Inside the atria, we're also going to have an indent in here. That's a remnant of a fetal structure. The indent in the heart is referred to as the fossa ovalis. What it was in the fetal structure was the foramen ovale. It was a hole connecting the right and left atria. By doing this, it bypassed the entire pulmonary circuit. That means the blood that went between the two never went to the lungs. Well, in fetal circulation, it makes sense because the fetus isn't really breathing by using its lungs. So we're bypassing that pulmonary circuit. So from this right atria, we need to head down to this structure, the right ventricle. We'll pass through this valve you see in the back here. So if we try to get to a little better view, we're going to notice that here is the tricuspid valve, also known as the right atrioventricular valve, or right AV valve. It's what prevents blood from passing from the right ventricle back into the right atrium. So we have the right ventricle with the tricuspid valve. Because the ventricles can generate so much pressure, these valves have to be really locked in place, anchored down. That's why it has these white strings, or chordae tendineae. The chordae tendineae are going to allow for it to be anchored down to these muscles, the papillary muscles, here, here, and here. So the papillary muscles anchor the chordae tendineae, which holds this tricuspid valve in place. But that's not the only musculature you can see in the ventricle. If you notice in this reflected area here, this is part of the ventricular wall. All these lines, as well as all these lines, are going to be showing the trabeculae carneae, the musculature of the ventricle. Well, from here, the blood needs to go up and out. It's going to head up towards this valve right here, which is known as the pulmonary valve, or the pulmonary semilunar valve. From there, it goes into this vessel. It's blue because it's oxygen poor. It's called the pulmonary trunk. The pulmonary trunk is actually an artery. it's carrying blood away from the heart. Pulmonary refers to lungs. So the pulmonary trunk goes up to the right and left pulmonary arteries. They're heading to the lungs to pick up oxygen, drop off carbon dioxide. Well, then they'll have to come back to the heart. They'll come back in through, we can see right here, the left pulmonary veins and the right pulmonary veins. That's bringing the blood back from the lungs into the left atrium now. So now on the left side of the heart, the oxygen-rich side of the heart. The left atrium will still have those pectinate muscles that we had on the right. You can see the little ridges right here for this reflected back. So from this left atrium, we head down through this valve into the left ventricle. This valve is known as the mitral valve, or the bicuspid valve, or the left atrioventricular valve, left AV valve. It is also held in place by the chordae tendineae to the papillary muscle here, another one here. We still have the same musculature in the wall of the ventricle, the trabeculae carinae. So from here, you now have the oxygen-rich blood that's ready to transport oxygen and nutrients to the rest of the body, the entire systemic circulation. It's going to head out of this left ventricle. As you can see, this little bit kind of hidden back here, but that's part of the aortic semilunar valve. It's a little shade back there. The aortic valve, or aortic semilunar, will allow the blood to head up into the aorta, which is what we see right here coming up. The ascending aorta, aortic arch, and then potentially down the descending aorta. But not all the blood is going down the descending aorta. Some is going to go up one of these three vessels. As the blood comes up the aortic arch, the first vessel it comes into contact with, this one right here, is the brachiocephalic trunk. It can carry blood up and away from the heart towards the right side of the head and right arm. The next one right here is your left common carotid artery. That's carrying blood up the left side of the neck into the left side of the head. And the third and final one going up is the left subclavian artery. Well, like it implies, subclavian, below the clavicle, is carrying blood to your left arm. So you have three branches coming off of this aortic arch. But another structure to note, see these little fibers right here. They're helping to anchor the aortic arch down to the pulmonary trunk. These fibers are called the ligamentum arteriosum. At this point, it's just a ligament helping to anchor. But it was a fetal structure. This was the ductus arteriosus. It was a tube, a duct that connected the pulmonary trunk directly to the aorta. So in fetal circulation, the blood would come into the pulmonary trunk, and some of it would go right on through to the aortic arch and out. Again, bypassing the entire pulmonary circuit. So we have these two different methods in fetal circulation of bypassing the pulmonary circuit. Now another structure of note, if we can go back again for a second, we can notice that right in the middle of the heart here, in between the ventricles, we have this barrier. That's known as the interventricular septum. It separates the right and left ventricles. Between the atria up here is called the intraatrial septum, separating the right and left atria. And then if we head towards the back, all the way back here, we can still see the aortic arch coming down, descending. We can see the left and right pulmonary veins coming back in. we can see the superior vena cava, inferior vena cava. But what's of interest is this structure right down here, this larger kind of sinus. This is the coronary sinus. The coronary sinus is going to collect all the blood that was used to feed the cardiac muscle. So all this coronary circulation, all this blood that was giving nutrients and gases to the cardiac muscle will be collected by the coronary sinus. The coronary sinus can then dump the blood back into the right atrium. So if we skip all the way back to this right atrium here, you can notice the superior, inferior vena cava, and coronary sinus is coming in. So we have 3 ways of draining blood into the right atrium. So overall, this is the heart, full of cardiac muscle, full of various musculature in the atria and ventricles, and plenty of force generated by both ventricles. But which ventricle generates more force, the right ventricle or left ventricle? Left ventricle must generate more force because it generates the force to push blood throughout the entire systemic circulation. That's what creates part of your blood pressure. While the right ventricle still has pressure and force, but lower pressure because it's only going to the pulmonary circuit. It's only going to the lungs. So this is your heart.